Solutions Consultant with Wolters Kluwer, and joining me on the call today from Wolters Kluwer is Mary Starks, our Integrated Marketing Manager. Before we begin today's webinar and introduce our main speakers, I just want to cover a few quick housekeeping items. Today's meeting is listen only, so please use the Q&A option on the menu bar to submit questions. We will leave time at the end to address submitted questions. From your menu bar in the chat window, you are also able to download a copy of today's presentation, as well as you will see information regarding Kucero's Corner, which I'll be talking about in a moment. Today's event has been approved by HCCA for 1 hour of continuing education. An email with the CEU information will be sent out tomorrow afternoon to any attendee who is logged in to GoToMeeting. And now I'm happy to introduce our speakers, Richard Kucero and Jillian Bauer. Richard Kucero is the CEO of Strategic Management Services, LLC, a Virginia-based company that provides consultative services to healthcare providers on government health programs and specializing in developing, implementing, and measuring effective compliance programs for healthcare businesses. He served as the Department of Health and Human Services Inspector General for 11 years. Dick also writes a compliance blog, Kucero's Corner, which is hosted by Wolters Kluwer. As I mentioned, you can access that blog to register from the chat menu, and also the final slide of the presentation has information on how to subscribe as well. Jillian Bauer is the Vice President of Business Development at the Compliance Resource Center, a subsidiary of Strategic Management Services. Compliance Resource Center provides a comprehensive, integrated, end-to-end compliance management tools that include compliance surveys, sanction screening services, and Policy Resource Center. She was a healthcare consultant and analyst at Strategic Management before joining Compliance Resource Center. Jillian has worked directly with healthcare organizations to review their compliance programs. Dick and Jillian?
Thank you very much, Lynn. As you mentioned at the outset, Wolters, of course, does host a blog that I provide content for. And one of the things that we have seen in feedback from that blog site has been an ever-increasing interest and need for information as to how to evidence effectiveness of a compliance program, which has led up to this program. The fact is that with more than 1,000 people registering, I think that we are hitting a subject matter that a lot of people are most interested in learning more about. The difficulty that we have on this presentation is the limitation in time that's available. We could spend a whole day on this. So what we're going to try to do is focus on trying to understand the difference between output and outcome metrics in terms of evidencing compliance program, and then try to give examples of how that can be applied in various elements of the compliance program, and then focus on 3 areas that the OIG has specifically outlined as evidence that a program can be viewed as being effective. So that is basically what our objectives are for today, and let me turn it over to my colleague, Jillian, to get the program started.
Sure. Thank you, Dick. And just to reiterate what he was talking about in terms of our agenda today, the presentation is really going to cover the different types of metrics, and specifically metrics that address your compliance program, and specific ones including independent assessment, surveys, and benchmarking metrics. The OIG issued their first compliance program guidance in 1998, and that was targeted at hospitals. Over the past decade and a half, the compliance programs have evolved, and more so what has been expected of those compliance programs from the OIG. It's no longer sufficient to simply have the 7 elements in the compliance program. You must show that your compliance program is working, meaning that it's preventing fraud, waste, and abuse within your organization, that employees are aware of their compliance obligations, and so forth. So the metrics have really created a new dynamic in your compliance program that really helps to drive your organization. This slide here shows you a list of different metrics that can really be utilized to evidence effectiveness, and we'll go through some of them in more detail throughout the presentation. But really the bottom line here is that metrics can provide your management and also your board with some needed information on the return of investment on those compliance programs. Metrics can evidence effectiveness, but you must identify the means for measuring that degree of effectiveness. Effectiveness relates to the outcome, so the means for measuring must be specific, they must be relevant to the area, They should provide you with both short and long-term insight, so it really helps to plan your audit plans and look at the program in long-term goals. It should also help you understand internal trends to see how the organization is evolving, and also to point out some areas where further attention or need is necessary. As mentioned on the first slide, more is expected as a result of operating a compliance program. The OIG and the U.S. Sentencing Commission both stress the importance of having an effective compliance program. The U.S. Sentencing Commission were the ones who established what those 7 elements would be, and the Office of Inspector General really took those elements and made them applicable to the healthcare industry. Increasingly, your board and your executive leadership are really looking towards those measurements, those metrics to identify what is effective, and they want to see that return on their investment into the program. So metrics will help to identify both those strengths and those weaknesses within your program, which will essentially help you focus really on what your target areas need to be, where you need to be doing more auditing and monitoring, and also where you should be training your employees.
This slide basically talks about the Sentencing Commission that Jillian alluded to in the OIG, and gives some quotes with regards to some of the ways in which they could view a program as being effective. We're going to be coming back to this in more detail, but notice that both Sentencing Commission and the OIG really talk about both culture. They talk about basically the program really depending upon employees, and where the OIG has gone further to talk about how you can go about finding out from employees whether or not they have an appreciation for the compliance program, understands how it operates, and that they have been educated on terms of their personal obligations. Some of the questions you may want to ask about effectiveness, and that is, how do we know that the compliance program is working the way it should be? What happens with the reports of violations? Was training effective in communicating compliance? Are we less vulnerable to non-compliance liabilities? And then also how we could evidence that the compliance program is operating the way it should be and is being effective. The development is the challenge, and that is, do you have, as Jillian pointed out, availability of objective and measurable data? And how is this data that you're using, how would it be viewed by a third party? Would they question its integrity, or would they find it very credible? You also have to determine what data is the most useful in making your case that your compliance program is effective. Using a metrics means that you really should have those metrics evolve and change and become enhanced with the development and advancement of the compliance program. What that means is, as the compliance program matures, the metrics that are designed to measure its effectiveness should also change as well and evolve. So there should be an ongoing review of what metrics you're using, and begin to think about what other new metrics that you might want to have. The same concept is also when you're measuring any single element of the compliance program. The difficulty you have sometimes is that a lot of people talk about wanting to have a dashboard whereby you can look at the dashboard and really have a good idea what the compliance program is doing. The problem is that many people have gone to such extremes that the dashboard looks like the cockpit of a 747. Then what you really have to decide upon is what of those dials do you really find that are really most useful, and focus on the metrics that advance the objectives of the program the best, and not just have numbers lying all over the place. I think I wanted to talk here a little bit about definitions, because in our experience with clients, so many of them have difficulty realizing what we're really talking about. When you talk about effectiveness, you're really relating to outcome, in producing a decided, decisive, or desired result. It is not process in itself. If you talk about the number of patients that are being treated by a doctor, that's process. And that's an output. If you're talking about how well the patients did as a result of that care of the physician, you're talking about effectiveness. Performance metrics measure an organization's activities and performance against standards and values. Now, what that comes down to then is the 2 points that I've made at the outset of my first comments, and that is output versus outcome. Output relates to what is being done, volume, quantity, or amount resulting from a process, but does not answer the question of how well it is working. Whereas outcome, and remember, effectiveness is a term that relates to outcome, not to output. Outcome is change, benefit, or other effects that happen as a result of that process, and it provides information as to how well that process is working. Now, I would just note one thing. Jillian mentioned that in the original compliance guidance that started off this whole movement by the OIG was for hospitals. In that original compliance guidance documents for hospitals, the term effective in its various root forms was used 19 times. And I will tell you that as a former Inspector General, any time the Office of Inspector General or any government agency uses the same term in various forms 19 times in the same document, it means it puts some high value to that, that document, or to that term.
So now we'll examine some commonly used metrics, looking at both output and outcome. So there's a whole host of output metrics that can be used. And as Dick was talking about in terms of the definitions, remembering that output is related to what is being done. So looking at the volume and the quantity of something. So some common output measures that you may want to look at include how many people were trained, how frequently are they trained, how many policies have you been able to develop and implement, and how many reports were received through the hotline. So while these outputs are good to know, they don't necessarily tell you if that volume or quantity is a good or bad indicator. So going back, talking about some of the examples that Dick was talking about, just because you have 10 calls that are made to your hotline, do you know if that's a good indicator because people feel comfortable about reporting through the hotline, or is that an indicator, is that a bad number because people are, reporting a concern or a problem? So the next several slides really are going to show you how putting together both the output metrics and also the outcome metrics can really give you a fuller view of the metrics.
Let me just, well, go ahead. I want to get to training. What we really want to do is try to see if we can apply some of these principles. And what you're beginning to see now in the series is for each of these slides that we start talking about various elements of the compliance programs, we're going to try to put both output metrics and outcome data evidence and put them on the same slides and give a contrast to it.
Sure. So the first element of your compliance program that we'll look at is the training. So there are several output metrics you'll want to track. Obviously, the number of employees who were trained, the time frame it took for them to complete that, whether you give them 2 weeks or a month to complete the training, the frequency of the compliance training, do you do it annually, do you do it biannually, and then what type of training was provided, was that online or in-person training. So once you have these output metrics, the next phase is really to look at them in terms of the outcome. So remember, the outcome is the change or the benefit of that process. So you want to look at and figure out how well do employees understand the training, and do they understand what's expected of them in terms of compliance and handling their responsibilities. So this can be learned through having the employees complete quizzes or address case scenarios during the training. And it also can be shown later on after the training. You can also deploy a knowledge survey to see how well the employees actually retain that information after they've taken that training. There are a lot of tools and applications out there, some through vendors, some that can be handled in-house, that can really help you put together both the output and the outcome data in one application. So looking for applications or services that can show you how to track the number of employees who are trained. That includes quizzing them and also issuing certificates so that the employees have some documentation that they completed the training.
And the point here is just keep that in mind, that if you take that snapshot at the end of training, that doesn't mean that they've retained it all for long term. So keep in mind that you may want to have not only that information at the time they completed training, that they understood it, but sometimes later to see how well they've retained those lessons.
Yeah, exactly. So those quizzes that you can do during the training really give you immediate feedback on how well the training was received. And then as we're talking about doing surveys later on, can show you how they retain that information. So the next component is the code of conduct. And so common output metrics would be, is it written at a 10th grade level? Do all employees receive the code? Are there certain policies, compliance policies covered within that code? Were they trained on the code? Can they access the code? So a lot of these metrics can simply be answered with a yes or no. But then looking at that outcome data is a more telling metric for you. So when we talk about do your employees understand the code, many times the code is provided to the employee at the time of employment or periodically if it's been updated. And the way that employees are made aware of that code is through the training. It's most often incorporated into your compliance program training. So again, within, as we were talking about with the training, you want to incorporate quizzes or questions that address the code that the employees can answer. And then also, is the code being enforced? Are employees complying with that code? And so a measure here is being able to do some auditing or monitoring or observing the employees within their work practices to make sure that they're carrying out business in accordance with that code. Next, looking at compliance-related policies, which also kind of ties in with your code of conduct because it's also another written guidance document that employees adhere to. So within the OIG's compliance program guidance documents, they do list several high-risk policy documents that organizations should have. So, you know, one measure right here is, do we have these policies that the OIG is recommending? And then also, are employees trained on those policies either during annual compliance program training or regularly during staff meetings if a new policy is implemented? So when looking for outcome metrics, it's important to know whether the policies are being adhered to and are enforced. So to learn these metrics, you need to conduct audits and interviews that focus specifically on the policies and procedures that these employees are trained on and that they should know about. And this way you can monitor the employees' work to make sure that they're adhering to those guidelines. The other important component here with policy documents is to make sure that they're actually being reviewed, they're being updated on a timely basis, because it's very hard to ensure that your employees are adhering to policies that are out of date. So that's the other side of things, is making sure that those policy documents are always updated and revised and available to those employees.
One of the big issues related to this is that we find that in going out and working with compliance officers that a lot of them really don't have a policy management system or compliance-related document management system. That means where they have a way in which they can have triggering events whereby they would review the documents and update them, or that there's a mechanism by which they can determine when there's a need to have some changes, either through some sort of regulatory change or manual change by CMS, or as a result of employees going back with having problems understanding their written guidance. But this is one area where we see weakness, a lot of weakness, where there is not a good policy management or compliance-related document management program.
Another major component of your compliance program is your sanction and exclusion screening. So common outputs on this process obviously are how many names are you screening, and this can be broken down to the number of employees, physicians, vendors, and contractors. And also, are these individuals and businesses being screened prior to employment, prior to engaging with them? How frequently are you screening? Is it monthly, quarterly, annually? And then also, which databases are you screening against? So these output metrics will evidence that you're complying with the requirements, but actually examining the outcomes reveal more about whether your process is actually effective. So you want to examine names that were matched or are possible matches to an excluded party and how those matches are resolved or confirmed. So what is the process for making that determination of considering somebody excluded? How is that being communicated back either to HR, to management, or even to the OIG? Another thing with your sanction screening is you want to make sure that all of the reports and the records that are being screened, that is signed off and dated by the responsible person who is conducting the screening. So with our sanction screening, we try to provide a comprehensive report to our clients that includes both of these recommended output and outcome metrics. So making sure that that report includes all of the individuals that were screened, the methodology of how the names were determined to be matched, and also how those matches were resolved. And then we sign off on all these reports provided to our clients. Another major component, again, is the hotline. So the hotline provides a lot of useful outputs, and you'll want to track. The hotlines tend to give you very good output numbers because you can easily track how many calls were received in a given time period, the type of calls that were received. In terms of the types of calls that were received, it's always helpful if you can categorize the calls. So you may want to categorize them, one, by priority level, and then two, also by topic area or concern. And this will examine when we talk about how you can use that for your outcome metrics. You also want to look at the response time to the reports, whether that's measured in hours or days, how long it takes to respond, and then whether the reports were resolved, either yes or no. So then using these outputs, you really can then look further into your outcome metrics. So looking for different types of trends or patterns for your reports. So going back to making sure that the reports all have a category they're assigned to. So whether this was related to a HIPAA violation or was this an overpayment issue, being able to categorize those calls will help you to track trend analysis over time to see where additional attention or remediation is needed. And then the last area that I want to talk about with the compliance program is responding to detective offenses. And this area can also be addressed in conjunction with reports that you receive from the hotline. So this can also include reports that are made directly to your managers, to your HR, and even offenses that are detected through doing routine audits. So common metrics would be the number of issues that have been identified, how many have been resolved, again, the nature of that issue, and then the method for identifying that issue, whether it was through the hotline or through an audit or a self-reporting. So the outcome data even should evidence that the detective offenses are investigated and resolved, and then they can help you, again, identify patterns.
So far, we've given just some highlights. We're not saying that this is all the areas. For example, we didn't even talk about the oversight committees at the executive and the board levels and how you go about doing the output and outcome measurement there. That they basically do the same kind of a process of looking at it. We also did not go into the very large area of ongoing auditing and monitoring and what you should be doing in those areas. The idea is just to set up a thought process to differentiate between output and outcome measurements and try to put that thought process to work at all areas of the compliance program. At this point, what we want to do is shift gears. At the outset, I mentioned that there were 3 areas that were specifically defined by the OIG as areas where you could evidence effectiveness. Now, one of the problems is that even though in the original compliance guidance, the OIG spoke about effectiveness in 19 different times, when it came to explaining how you go about evidencing effectiveness, there was very little information in there. But there are 3 areas that they did mention, and this is what we want to go into a little bit more depth about right now. Number one is, as I pointed out in the quotes from the Sentencing Commission guidelines and from the OIG compliance guidance documents, that the OIG speaks about that having questionnaires or survey of employees to evidence their level of understanding of compliance and their obligations to comply is something that they believe is solid evidence of whether or not a compliance program is effective. They also talk about that you have to have a periodic audit of the compliance program effectiveness. I'll talk a little bit more about that in detail. But the third area where they mentioned it is just it goes across the line a little bit into ongoing auditing and monitoring, and that is they talk about how you can track claim error rates with the objective of reducing them against original or subsequent benchmarks. So let's speak about a little bit about the independent compliance effectiveness audits. What this really means is this, that the OIG says that all programs should be subject to compliance monitoring. All programs, including things like how your claims processing system, the cost report development, you name it, they basically want to see that there is an ongoing monitoring by the program managers. Now, what does that mean? It means that the program manager is responsible for making sure that they are up to date with whatever the rules or requirements are for their operation, that they've translated those requirements into written guidance in the forms of policies and procedures, that they've trained their employees on how to follow those policies and procedures, and they're monitoring their performance against those standards to make sure that they are doing what they should be doing. Now, ongoing auditing is different, and that is it can't be done by the program manager. It has to be done by somebody who's outside the program, and what that purpose is to verify that the ongoing monitoring is taking place the way it should be but also to validate the process to say that it is effectively achieving what the goals are for that particular program in terms of meeting compliance requirements. The same thing applies to another program, and that's the compliance program. So the compliance officer is really responsible for the ongoing monitoring, making sure their program is up to date and that the written guidances are being developed and the people are trained on that guidance and so forth. But the compliance officer and the compliance office cannot audit themselves. That is the same way that a claims processing manager cannot audit their own operation. It has to be done by outsiders. So this is an area where the OIG would find some credible evidence of how effective a program is if, in fact, that the ongoing auditing verifies that the compliance program is working the way it should be. So you have these various methods by which you can have assessments of the operation, but these are operational assessments, and these are not financial audits. And therefore, they should be focused on the operation. They should be substantive, in-depth, not just a checklist approach. They need to have a sound and tested and standardized methodology. The more it's been applied over organizations, the more often it has been applied, the better. The thing you want to have is they're going to have a credible evaluation of compliance program should be done by recognized experts, and that the results need to be credible, and they have to be supportable. What this means is that there has to be legitimate findings, and from those findings, that recommendations and suggestions are made for program improvement. But all suggestions and recommendations must arise from the findings. All findings must arise from the independent review that's been done by your experts. I also mentioned in there that the OIG is very partial to GAGAS, which are the generally accepted government audit standards. For operational reviews, there's two types of GAGAS standards, one for financial and one for operational audits. And what that means is that the important factors, standards you must meet with GAGAS here is that whoever's doing this work must be independent and objective. It also is very important that there is a full detailed report of the audit results. The second major area that the OIG has talked about, and we alluded to it a couple times already, is the survey metrics. What this means is that you ask employees about the compliance program. The OIG refers to questionnaires and surveys of employees. We want to ask them about what they know of the program. Do they understand what their responsibilities are? Those sorts of things. It is probably the least expensive, but probably the most underutilized tool that's out there. But there are difficulties because, for example, you can't have just anybody sit down and come up with a bunch of questions and then deliver them because they won't be credible. So there's some standards that you really need to meet that would produce reliable, valid, and credible results. And generally speaking, there are two approaches that can be made in surveying. One is the compliance culture of an organization, whether it's improving. The other was knowledge about the compliance program. So these are different metrics. They look at different things, but they both are supportable as to whether the compliance program is operating effectively. Another approach that is sort of a variation in terms of selecting people to be interviewed or those that are exiting the employment. As their employees departing, if you ask them some questions, they also gain some insights. This might be, there might be ways in which you can improve the program, or it may also show the program is in fact working the way it should be. The OIG does call for benchmark and evidencing. These are really closely related concepts between benchmarking and evidencing. Here I put a little definitional point here by saying that benchmarking is a point of reference against things can be compared or assessed. Now what that means is that if you did do a survey a year ago or 2 years ago and you do a survey today, is there any change in the survey and are the results more positive? So you're really benchmarking yourself against yourself and saying, look, we looked at this when we looked at it 2 years ago, here we were, here's where we are today, we can show the improvement. Or if you can benchmark against the universe at large, and that is against other comparable organizations as to how well they have done using the same instrument, and then you can see whether or not how you stack up in terms of compliance with others. The OIG calls for benchmarking, but as I say, they provide a little guidance as to the methods by which you can employ. that tool. Again, the value of survey results, if done correctly, can be great. You can quantify, provide quantifiable data, workforce knowledge and perceptions. You can benchmark and monitor compliance program progress. It can provide to the board and management level executive compliance committee some objective metric data that would show them that this is really something that is working. They can provide evidence of improvement or worsening compliance areas. They can identify strength, weakness as within the compliance programs that may warrant special attention. But also they send a message to employees that their opinions are valued. And that is also a morale issue, and it can be helpful to do that if you just think of that by itself as a useful reason for employing a survey. Because it underscores the organization's commitment, it also provides a very powerful message that the compliance program is important to the organization. Now, for surveys to be credible, surveys really should be validated, tested, and evidenced as being reliable. It should meet professional standards. It should be independently administered. One of the problems is that if you do an internal survey, employees may not really trust that they are providing information anonymously. They may feel that the organization might be able to track back and identify what the employees are saying about the organization. So how you administer it becomes very important. So you have to ensure that confidentiality, or you really are not going to have a very useful result. It can provide, as I mentioned earlier, both internal results and benchmarking to others. You can compare yourself or to yourself to other organizations. And in fact, the best surveys are those that are anchored in industry comparative data. What means industry, it means the healthcare sector.
And if I could just add one more thing for the credibility of the surveys, another factor that you want to consider is who's developing that survey. And as Dick had pointed out or mentioned earlier, was that anybody can really develop a survey. And to make the survey credible, you want to make sure that the folks that are developing it have the expertise. So, for example, with the surveys that we developed here at Compliance Resource Center, we actually had 2 PhD individuals who helped to develop the survey, and then it was deployed to a focus group to kind of field test the surveys to make sure that we get credible and reliable results back.
As mentioned earlier, there are really 2 types of compliance surveys. Those that measure the compliance culture, which is basically the employee's perceptions and attitude toward the organization's compliance environment. And the second is the compliance knowledge survey that measures employees' knowledge about the compliance program. Each of these approaches can provide clear and convincing objective evidence with regards to the compliance program, and if deployed over time, can show the progress of the compliance program.
So when we developed these surveys, we developed the culture one in 93, and we developed the knowledge one in 99. And with being able to use these surveys over the course of these decades, we've been able to also provide a good database of data that we can compare against. So when we have our clients and we're talking about being able to benchmark the results, it's always helpful, yes, to benchmark against yourself to see where your company has grown or progressed, but the other advantage is being able to benchmark against other organizations within the same industry in the same field.
Let me spend a couple of moments differentiating between the culture and knowledge surveys. The culture surveys normally are use a Likert scale, and that is that they have a choice, a range of choices, because you're really going to focus on their beliefs, their values, and thoughts and behavior. It does measure outcome or impact of the compliance program activities. It also measures compliance commitment, and it really kind of assesses the current compliance climate or culture. But the Likert scale is what you use there because as opposed to what you have in the next one, which is the knowledge survey, because it's a yes-no thing. Do they know it or do they not know it? So the knowledge survey tends to be a dichotomous question where it is basically a choice between yes, no, or don't know. Don't know and no are the same for our purposes. It focuses on employee-specific knowledge and understanding of the compliance program structure and operation. It can measure the effectiveness of an existing compliance program. And it does provide empirical evidence of them that the compliance program is understood by the employees. It uses very simple closed-ended questions, and it differs from the culture survey that is focused on attitude. Here you want to know, do they know it or do they not know it? Some of the key questions that boards oftentimes ask, as well as executive management, and that is regarding the how and why. And that is important that surveys can evidence the program effectiveness, because it basically says, here's objective evidence. This is something that we didn't manufacture. This is what employees are telling us. You have to make a question, for example, what kind of a survey would you use? Do you want to use the culture survey or knowledge survey? Another question would be, should the survey be developed internally or by a vendor? Other questions you may want to ask is, who should we survey? Should we survey the entire employee population or take a random sample? How can the survey be designed, tested, and validated? How should the survey be deployed to the employees to make sure that it is in confidence? How reliable will the results be? And how can the results improve the compliance program? And how should the survey be used? So if you think through these things before you make a decision about surveys, you go a long way in justifying your decision. Generally speaking, we, as an outside body coming in in-house surveys are not looked upon as being very credible or reliable. It's not independently administered. I don't want to make it sound like the government is cynical, but at the same time, they start off by assuming there might be bias in the development and administration, and therefore it undercuts the credibility. Most of the internally developed surveys have not been validated or tested properly to evidence that you are getting reliable results. It's a time-consuming to develop and test properly a survey instrument. As Jillian pointed out, what you do when you're developing is not only developing the question, you got to make sure the questions are understandable, that they're not ambiguous in terms of how a person might respond. And also, you need to have subject matter experts that would help design the thing, and then it needs to be tested so that you know that it gives you the right results. And also, one of the limitations you have for an in-house survey is that it's unable to permit you to compare yourself against other organizations that have been similarly queried.
So then, on the flip side, utilizing a vendor and what that vendor can really offer you is that a lot of the surveys and the services that they provide have been tested. Excuse me, they're unbiased and they're validated. And as Dick was talking about, sometimes it's hard to get that when you're doing the survey in-house. And also, it tends to be far less expensive to utilize a vendor than to handle it in-house. And some of those reasons is because you have to develop the survey, but then you also have to test that to make sure that the results are valid, that as he was saying, the questions are unambiguous, that employees are understanding what the survey is for. Another thing that the vendors can offer you is that they have that expertise in the compliance program, and you want to make sure that you are utilizing a vendor that does have that expertise so that they are able to provide you with not only a survey that's crafted towards understanding the effectiveness of your compliance program, but then they can also offer you some guidance and some analysis of what those results mean from the survey. When you look at the survey and figuring out what would be suited for your organization, a reasonable length for the survey is that it's anywhere between 10 to 30 minutes. The typical completion time for the surveys that we develop and deploy for our employees is usually between 10 to 20 minutes. When you use the Likert scale, the results, which are range from strongly agree to strongly disagree, tend to take employees a little bit longer just because they're trying to think about that question a little bit more, and their thoughts and their perceptions really go into forming their answer. Whereas the knowledge survey with those dichotomous questions of either you know it or you don't know it is a little bit easier for them to get through. But on the other side of things, and looking at the time consumption to complete the surveys, you also want to think about if the survey is too long, employees start to become less interested in reading through the questions and just more so just trying to put any answer down to complete the survey. And so you want to make sure that the survey keeps the employee engaged through the entire set of questions. And then also ensuring getting buy-in from those managers whose employees will be taking the survey, that you don't take those employees out of the work too long. So within 10 to 30 minutes seems to be a good time to complete the survey. Then the other side is with delivering the survey. So there's two ways that you can deliver the surveys. You want to consider either a paper survey, which is the manual process, and then electronically deploying that. Within today's age, with the advancements of technology, the cost and the time efficiency to do it electronically outweighs the benefits of doing it manually using that paper process. Also, utilizing something electronically helps you to calculate and validate those results much quicker. You can usually break down the results so you can see a subsection of if these employees within a certain department or within a certain facility, as well as getting the results for the overall organization.
On this next slide, all we want to do is point out that some tips on developing a structure for the questioning. If you develop it in-house, how you might want to, things you might want to consider. And then what we want to do now is talk about how you can use the results. So maybe you want to pick up on that.
Sure. So once you get the results and you're completed with the survey, it really can help you identify, again, those strengths and those weaknesses within your organization and where you either need to maintain the work that you're already putting in or whether more additional work is needed. And with those results, it's also important that you perhaps conduct follow-up or focus groups or interviews with employees because the results of the survey, the yes, no, it can only provide you with an output. It does only gives you the numbers, but what you really want to use the survey as is a way to identify what more can be done within the organization. And so kind of reaching out to a focus group of employees can really give you some additional feedback on where those areas may be.
This next slide talks about the frequency. You don't want to use the same survey over and over every year. There's got a lot of downside for doing it. If you do annual surveys, alternate them is the best thing because culture and knowledge may not change very much in the course of a single year. So you want to vary it or stagger it over longer periods of time. The next thing that we're going to jump to is another one of the areas where the OIG has focused some attention in terms of evidencing effectiveness of the program. It really talks about error rates. And what we're talking about here is that you see that the OIG has put a lot of statements with regards to benchmarking error rates. And that if you basically you're showing that over time the error rates are going down, then of course, then you're showing an improvement in the program. So let me just jump to the next slide and talk about this a little bit. The OIG calls for taking a snapshot will become a baseline to judge the progress in reducing or eliminating areas of vulnerability. And a baseline level can include frequency or percentile errors or error rates for various DRG or billing codes. The ongoing monitoring of claims should be this. Essentially what you're talking about is you're going to have a quality assurance program that has included in that quality control reviews, which are really nothing more than online testing. And what you do is you keep track of the error rates and who makes the errors and in what area the error is created. For example, if it's a certain claims processor that is involved in reimbursement processing that makes an error, you can't make an educational contact. If there's a pattern of it, you maybe go through a new education program or training. But overall, what you're really trying to do is evidence that over a period of time, the error rates are dropping for the individuals who are submitting the claims, are processing the claims, or people that are creating the claims. And that what you're really doing is have the fewer error rates and fewer kickbacks. Now, what this does mean is in addition to reducing error rates, which would be definitely an evidence the program is working more effectively, is the fact that if you do it right the first time, it's a lot cheaper than having to make corrections over numerous errors that are kicked back by the payer. So this is an area that they put a lot of attention to, and it really is. This is where it sort of dovetails into the overall larger area of ongoing auditing and monitoring. The monitoring is what you see here. The ongoing auditing would be somebody coming behind this to see whether all this process is working the way it should be. So at this point, we'll turn it back to Lynn, and then we're prepared to answer questions, recognizing that we've only scratched the surface, and we apologize for not being able to go into more detail, but the time really does limit us on that score.
Great. Thank you, Dick. And I'm just going to take a couple quick moments to talk about ComplyTrack, the Wolters Kluwer solution, and how it can be utilized to address some of what Dick and Jillian were talking about on their presentation today. And to do that, I'm only going to take a few quick moments, and then we're going to address the questions that have come in. We've gotten a lot of questions. I encourage you to continue to submit your questions. But the first piece of ComplyTrack I just want to highlight for you quickly is our Risk Assessment Manager. And what we're doing with the Risk Assessment Manager is we're providing organizations with pre-developed question sets that you can utilize to do your own internal risk assessment. And we address a wide variety of areas, including the OIG work plan project areas, Medicare conditions of participation, HIPAA, to name a few. But the one that I want to highlight for you is our OIG Compliance Program Guidance Library. And we have these assessments for a variety of entity types. And what we've done is we sat down with the OIG's compliance guidances and supplemental guidances and went through them and put these assessments together. So if you are an organization that perhaps hasn't looked at your compliance program in a number of years, you've developed it and perhaps it's sat on a shelf a little bit and you want to refamiliarize yourself, or do an initial assessment internally to make sure that it is containing the things that are discussed in the compliance guidance, that we have these assessments that you can work with. We've divided them into the different elements of an effective compliance program. If I come into one of these as an example, you can see after each question we have a citation link. So all of our questions tie to the documents that the questions have been taken from. So I can see that this came from the Compliance Guidance for Hospitals, Section 2A2, and I could click on this link and go right into the document. For the sake of time, I won't do that. But we do have these assessments. So first thing you can do as an organization is review your compliance program. If you want to bring in an outside group, fantastic. If you want to do that yourself and own that initial part of the process, that you can do that as well. I also want to highlight our Survey Manager. And the Survey Manager allows you to be able to create surveys on anything you want that you can send out to as many individuals as you might need to for response. So if you wanted to do some of those knowledge-based surveys that Dick and Jillian were talking about and just send out something basic perhaps to ensure that your employees are familiar with your compliance program and know who your compliance officer is and know that there's a compliance hotline and how to access it, for example, you can create a really basic survey in our system to be able to account for that. You could also use the Survey Manager to do some compliance training with staff. You can send them policies or other documents, PowerPoints perhaps, through the Survey Manager and query them through the system on their understanding and have them attest to the fact that they've received and read them. You can do exit interviews through the system and get feedback from individuals regarding their experience within the organization. And you can do anonymous surveys, so getting to the point of individuals being a little concerned that there's going to be some sort of repercussion against them if they're disclosing their thoughts when you're talking perhaps about the culture of the organization, that you can do anonymous surveys where names are not going to be tied to responses. A couple other pieces that I want to quickly highlight. Our Activity and Event Manager. And the Activity and Event Manager gives you the ability to document and track all of the different things that occur within your organization, whether those are issues or incidents or things that you're doing periodically, again, because your compliance program or your policies and procedures say you're going to do them. So if you're doing ongoing monitoring regarding your compliance program and different elements of it, you can manage that here. You can create and manage action items based on any auditing or monitoring or survey results that you uncover. There's a wide variety of reports in the system that are going to allow you to track things like how long is it taking you to resolve issues that you're capturing within the system? And you can see, are we getting better? Are we getting quicker at resolving the things that we're dealing with? You can do analytics where you can track and trend the information that you're capturing very easily, being able to create pivot tables and charts of the information that's being built into the system. So I can see here the education that we've done at the different facilities within our organization through the years. And are we conducting this training? Are we providing refresher training on our compliance program perhaps as frequently as we should be? And then without going into them, just to highlight for you, we have a document manager. So being able to manage your policies and procedures in the system. We saw in the slide the importance of ensuring timely review and revision and updating of policies. You can account for that within ComplyTrack and make sure that if you have a 2-year policy management process or a 3-year, or however frequently you're going to be reviewing them, that they're being reviewed. And then lastly, our audit detail manager. So being able to use our system to track identified claims errors and again be able to do analytics. Are our claims being denied for the same reasons over and over, and being able to identify those and address them as an organization. So at this point, I am going to bring up the last slide again to, again, highlight how you can get in contact with Jillian or Dick if you want more information regarding the presentation. If you'd like to be able to subscribe to Kucero's Corner, that information is on the slide as well. And what I'd like to do at this point is address as many of the questions that have come in as we can in our remaining time. So the first question, Dick and Jillian, on slide 15, you indicated we should have outcome evidence of how matches are reported to OIG. Would that be for any matches that are found after the party is excluded?
If you get a hit, it's a raw hit. The question is what steps did you follow to resolve that hit to determine whether it's an exact match or not an exact match? What you need in the report that Jillian had alluded to is that you will explain the process by which you would have eliminated that person as being identifiable with somebody who is on the exclusion list. Or in the alternative, if a positive identification has been made, then what did you do with that information? Of course, the OIG says you should disclose it to them. The important point here, though, is the OIG in a recent bulletin on the subject said that they are only interested in hits on the LEIE, the list of excluded individuals and entities. They're not interested in any GSA hit. You get a GSA hit, they could care less about it. They have no action authority on that. They're not interested in that at all. The only other area that you need to worry about, though, then is whether you have a Medicaid exclusion hit and what the state requirement is for that. But in either case, what you really do need, and what Jillian was emphasizing, is that if the government came in, they wanted to know whether you pursued this process with good due diligence, then where's the evidence to show that you did do that? And that's where your report has come in. And of course, what it needs to be is you have to have a responsible party that needs to sign off on it, that explains in the report what you did and what the results was and how you resolved any potential hits. Or if you use a vendor, have a vendor certify the results.
Great. I'm just going to ask this next question because it's for me, and then we'll get back to all the ones for you. Someone did ask where they could get more information on ComplyTrack, and I will say that you will have one of your sales reps from your region following up with you after the webinar today, so thank you for that question. Dick and Jillian, can you please provide examples of high-value compliance audits?
Well, I think I would go back to what the OIG said about, and that was the last area that we covered, and we went over it very quickly. But if you wanted to talk about focusing on one area, then one area within the whole universe of monitoring and auditing, then I would look at the claims processing system. But if you were to try to say, no, what I'm really looking for is that if I could do only one thing to evidence to my board or to the government or to somebody or to management that the compliance program is on the right track and moving in the right direction, then you have a choice. You have a choice of you could use the survey methodology, but actually, I would actually say the more convincing evidence would be an outside experts coming in and evaluating the program in depth, and then providing an independent report on the results. That would not only be more convincing, I think, to your board or to executive leadership, but also would be more convincing to an outside agency such as the Office of Inspector General.
How often do you recommend surveying employees?
Well, I'm going to leave that to Jillian. We covered that in the program. You don't want to over survey them.
Yeah, sure. As we were talking about on that frequency slide, you don't want to, like Dick said, you don't want to over survey the folks because then they just become disengaged in the whole process. So what we recommend is if you're going to do it annually, then don't do the same survey 2 years in a row. So two of the surveys that Dick was mentioning, both the knowledge survey and the culture survey, you may want to alternate between those, or just have 1 year where you don't do the survey, but at least doing it no more frequent than annually.
Great, thank you. I think this one is again for me. Do you offer a platform on which to file issues by employees? And that would again be the activity and event manager component of ComplyTrack. So I would encourage you when the rep gives you a call to about that in a little bit more detail, because you can do that within ComplyTrack. Dick and Jillian, where can we find benchmark data referenced in the presentation?
Well, certainly you can download the presentation itself. I'd also, you might, again, give a plug back for the blog. If you go to the blog, there's a history of articles on the subject of compliance metrics, and all of them have hyperlinks in them to where you can go to various more detailed information with regards to the subject matter. So go to that Kusra's Corner, and then when you go there, look at the history, and the history is organized by topic. And I would go for the metrics. And if you pull up those blog articles, there's a lot of hyperlinks in there that will probably take people to where they can get the kind of information they want in more detail.
Who should conduct an external review of the compliance program, and how frequently should this be done?
Well, to be pretty frank about it, I mean, the OIG would say love to have it done every year. I don't think that it should be done every year. Number one, it's sort of like surveying, is that if you do a culture survey, the culture doesn't move that far in a year. The same thing is true with the compliance program. If you do an evaluation of the compliance program and you have a lot of findings and you have a lot of recommendations and suggestions, there needs to be a period of time where those changes and corrective action measures and improvements can be put into the system and then sort of baked into the operation of the program. So if you did that every year, I think that you would find diminishing results. I think probably every 2 or 3 years would be what I would recommend that you do for that particular method of evaluating the compliance program. I wouldn't do it annually.
Great. And I think we have time for maybe one more question. So for anybody who asked a question we didn't get to, we can respond to those. Jillian and Dick can respond to those post-webinar. But I think our last question will be, what net financial error rate should be used in an internal review of a sample of paid claims to trigger a larger review of a statistically valid sample of paid claims and extrapolation of an overpayment amount? 5% is often used by the OIG as the trigger for a larger review in the context of claims reviews under CIAs. Is there an expectation of a 95% compliance rate?
Well, we can do a webinar on that subject. Let me just see if I can take it in part. What the questioner is really saying is that they've noticed that in corporate integrity agreements that where there is a claims review, if the error rate exceeds 5%, then what that does is that calls for a much more detailed review. If you are, I would give this a serious advice, and maybe we should do a program on this, because we have seen organizations do more harm to themselves by mismanaging what this question is all about. If you want to take a look at, if you have any indication that you have an error rate problem, what you should not do is have your outside auditor come in and do a retrospective examination for the last 2 years of error rates, because all of a sudden you have a disclosable event and you invite the government in to see why you have so many errors. If you want to find out what your error rates are, and this is over and above what I did on the ending slides where I started talking about the quality assurance program with quality control reviews. But if you wanted to do a sample of some sort, what you might do is follow what the OIG has suggested in their RATSTATS methodology. I would take a RATSTATS cell sample. From that, I wouldn't review those. I would take from that a probe sample and do a selective probe sample of that RATSTATS cell to look and see if there are indicators that you have a pattern of any sort of errors. If you do that, you do not. If you're doing a probe sample of a RATSTATS cell, you do not have the kind of results that would have to be projected with any degree of reliability to the universe that would have to be disclosed to the government, but would give you an indicator of where you should put some attention to correct matters, and also give you a warning as to what steps you might want to take in case that non-representative sample, in fact, would be borne out by further review. But I think I have to stop there. But I mean, I could probably talk on that for no more than maybe 2 or 3 hours. But the fact is that this is a very good question. It is something that really requires a lot of attention, and a lot of people have really harmed themselves by not understanding what it is that they should be doing in terms of quality assurance in the claims processing system.
Great. Thank you so much. And Dick and Jillian, thank you so much for the webinar today. It was fantastic. And thank you all for attending, and have a wonderful afternoon.
Thank you.